What are the causes of vaginal pH imbalance? Having a vaginal discharge is the most frequent complaint of patients regardless of age. For menstruating women, the incessant use of panty liners has been contributory to causing vaginal irritation and infections. Ideally, it is recommended to use panty liners during the light days, when your menstrual flow has already markedly decreased. However, to use it as a daily wear may result in skin discoloration, marked vaginal dryness, and inflammation from this prolonged use, which may lead to chronic vulvar itchiness and recurrent infections. A lot of women don't realize that these panty liners keep the vulvovaginal area very moist, allowing the spread of any discharge coming from the butt into the vaginal area. Furthermore, it creates an environment that is less acidic and therefore disrupts the ecosystem of the vagina. And therefore, the best advice that I give to you is to keep that intimate area well ventilated. And when patients come to me, this is what I say. Change your underwear as often as necessary rather than the use of panty liners. But more importantly, it is important to address the underlying cause of the vaginal discharge. What are examples of discharges that women experience? If it presents with a fishy, foul-smelling discharge, even without the benefit of a laboratory test, it could probably be due to the lack of the naturally occurring good bacteria, lactobacilli. If, on the other hand, a curd-like, milky, itchy discharge, more often this is associated with a yeast infection. Other times there may be yellowish and greenish discharges that could come from other sources, other bad bacteria, or it could be a sexually transmitted infection. Now, what are the other causes of vaginal pH imbalance? This will include 1. Hormonal changes. Women in their childbearing years or premenopausal age of 40 to 50 years who may be menstruating may complain of vaginal dryness and occasional very scanty vaginal discharge. This is due to the decreased levels of estrogen. In postmenopausal women, these are those beyond 55 years, the complaint of vaginal dryness becomes more prominent, and this is resulting into the vaginal pH imbalance of less than 3.8 to 4.3. Now, there are other instances where the vaginal pH imbalance may be due to the use of certain antibiotics that may result in curd-like milky discharges and resulting in a yeast infection. The other bad habits are overused napkins, tampons, menstrual cups, intrauterine or contraceptive devices, and remembering that your menstrual period itself, the blood in itself, may be the #1 cause of this change in the vaginal pH. Those with a history of diabetes may also experience this imbalance. Now, little did we know that the introduction of seminal fluid inside the vagina changes the vaginal pH, especially after sexual intercourse, because semen, as it is alkaline, and it may increase your vaginal pH to that of 5 to 7. Additionally, the bad habits that I've mentioned may also include douching, the use of perfumes or deodorants on the genitals, along with the use of inappropriate feminine wash products that do not conform to the correct acidic pH of 3.8 to 4.3, these may cause vaginal pH imbalance. Therefore, each woman will require individualized treatment. Not all patients are the same. We are all unique in ourselves. Therefore, remember, vaginal health is very crucial. There's no one permanent treatment.